higher secondary, second year, 12th zoology, chapter 3, reproductive health. The topic we are going to see is birth control. Birth control methods. What is birth control methods? The voluntary use of contraceptive procedures to prevent fertilization or prevent implantation of a fertilized egg in the uterus is termed as birth control. As we are seeing, there are two types of birth control. One is temporary and another one is one permanent one. Here, the natural, chemical, mechanical and hormonal barriers methods are temporary birth control methods. In this, we are seeing natural method. In that natural method, we also seen, so these are the topic: periodic abstinence or rhythm method and continuous abstinence and coitus interruptus. We are seen. The next one is the one lactational amenorrhea. What is lactational amenorrhea? Menstrual cycle resumes as early as 6 to 8 weeks from parturitions. After delivery, the lactational amenorrhea will take place. After delivery, the 6 to 8 weeks from delivery, the menstruations may start or sometime may delay. That is we call as a lactational amenorrhea. Due to lactational period, due to giving milk to the child, menstrual cycle may be delayed due to certain hormones. The reappearance of normal ovarian cycles may be delayed for 6 months during breastfeeding. What is reappearance of normal ovarian cycle? Again, the ovarian cycle will start producing it or start forming in the ovary. That can be delayed. That is going to be delayed due to feeding of milk to the child. This delay in ovarian cycle is called lactational amenorrhea. Amenorrhea means delaying of menstrual cycle, that is we call as a amenorrhea. It serves as a natural but an unreliable forms of birth control. It serves as a natural but an unreliable form of birth control. Suckling by the baby during breastfeeding stimulates the pituitary to secrete increased prolactin hormones in order to increase milk productions. So while the baby suckle means absorb the milk. Okay, the increased prolactin hormones may be secreted, and milk productions also will be secreted more. This high prolactin concentration in the mother's blood may prevent menstrual cycle by suppressing the release of gonadotropin, releasing hormones from hypothalamus. So there's high prolactin concentrations in the mother's blood, so may prevent the menstrual cycle due to a release of GnRH. What is GnRH? Gonadotropin releasing hormones. What are the use of this one? These hormones used to release the egg from the ovary. For that purpose only, this GnRH hormones are released from hypothalamus, and gonadotropin secretions from the pituitary takes place. So this may be stopped temporarily due to feeding of milk to the child. The next topic is the one barrier methods. In these methods, the ovum and sperms are prevented from meeting so that fertilization does not occur. Barrier means blocking one, okay, avoiding one. What they do in this one, the ovum and sperms are prevented from meeting so that fertilization does not occur. That is we call as a barrier method. The next one is the one chemical barriers. Next one is the one chemical barriers. Here the chemical barriers forming tablets, melting suppositories, jellies, and creams are used as a chemical agents that inactive the sperms in the vagina. So chemical barriers, they use some kind of tablets. Those who doesn't want to have child for certain years, they use some kind of tablets and melting suppositories and jellies and creams where with help of this one where they can inactive the sperms in the vagina. Okay, the next topic is the one mechanical barrier. Here the mechanical barrier, the condoms are used thin sheath. It's a thin cover, a thin membrane used to cover the penis. Male, where in females it is used to cover vagina. Male, the condom are used to cover the penis, and female vagina is to cover. And cervix, vagina and cervix just before the coitus. Coitus means reproductions. So as to prevent the entry of ejaculated semen into the female reproductive tract. This can prevent conceptions. Here barrier method means the male maybe use the condoms. So the same thing, female also can be used some kind of instruments to in the vagina and cervix to prevent the sperm's entry in the female reproductive tract where they can avoid of conceptions. The condom should be discarded after a single use. The condom should be discarded after single use. Condom also safeguard the user from AIDS and STDs diseases. So these are the condoms which are used by male. It is a single use, must be discarded after single use, and also the condoms used to prevent some kind of disease such as AIDS and STD disease. What is STD disease? Sexually transmitted disease. The coming topic, we will see what is STD disease. The condoms are made up of polyurethane. Just underline. One word they'll ask you. Important, underline. The condoms are made up of polyurethane, latex, the lambskin. Three things, just underline. They'll ask you 2 marks. Maybe one word also it is possible to ask. Just underline. The next topic is the one diaphragms. The diaphragms, cervical caps, and valves are made up of rubber. These are the instruments used for barrier methods of contraceptive. So diaphragm, cervical caps, and valves are made up of rubber and are inserted into the female reproductive tract. To cover the cervix before coitus. Coitus means, as I mentioned earlier, reproductions. In order to prevent sperms from entering the uterus. As the male use the condom in the penis, Same thing, female also they have used certain devices like diaphragm, cervical caps, and walls. And all these things made up of rubber, and it is inserted in the female reproductive tract to cover the cervix before the reproductions. What are the purpose of this covering the female reproductive tract means? In order to prevent the sperms from entering the uterus. The next one is one hormonal barrier. Hormonal barriers prevents the ovaries from releasing the ova and thickens the cervical fluids, which keeps the sperms away from ovum. So what they say here. So the hormonal barriers prevents the ovaries from releasing the ova. Releasing the ova. It prevents the ova is the one. Another name called of ova is called as a egg. You can say egg or ovum or ova. Here the from the ova will be released from the ovary. Okay, that will be prevented due to hormonal barriers. And also thickens the cervical fluids. The cervic parts, some kind of fluids will be secreted. So that fluids may be somewhat semi-solids. That's a thicken, which keeps the sperms away from the ovum. So they don't allow the sperms to go near the ovum. That is we call as a hormonal barriers. Then oral contraceptive. Oral contraceptives. Pills are used prevents the ovulations by inhibiting the secretions of FSH and LH hormones. That's a kind of drugs. Pills is the one kind of drugs used to prevent ovulations. What is ovulations? Discharging of egg from the ovary is called as ovulations. So this ovulations inhibiting means that stopping the ovulations by inhibiting the secretions of follicular stimulating hormone, that is we call as FSH, and luteinizing hormone, that is we call as a LH. So this two, due to releasing of these two hormones, they stop ovulations. The combined pills is the most commonly used birth control pill. It contains synthetic progesterone. It contains synthetic progesterone and estrogen hormones. The pills contain synthetic progesterone and estrogen hormones. There is a one drugs called as a Saley. Saley, the contraceptive pills by Central Drug Research Institute. But Saley is the one drugs are done, find out by CDRI, Central Drug Research Institute in Lucknow. In India, contains a non-steroidal preparations called centchromine. Preparation called centchromine. These have been introduced by CDRI, where can prevent uh, you can prevent the conceptions of young ones. The next one is called as a IUDs, intrauterine devices. Intrauterine devices. Here, intrauterine devices are inserted by medical expert. So it is a device I used to prevent conceptions or it can be inserted by medical experts in the uterus through the vagina. These devices are available as copper releasing IUDs, hormone releasing IUDs, and non medicated IUDs. IUDs increased phagocytosis of sperms within the uterus. So this is a kind of device can be fixed in the female reproductive tract. Once the sperms comes means this device which contain the chemical, that chemicals will phagocytosis, will kill or will swallow the sperms. The IUDs are ideal contraceptive for female who want to delay pregnancy. It is one of the popular methods of conceptions in India, as a success rate of 95 to 99 percentage. Just go through what is IUDs and go through what is oral contraceptive, then go through what is hormonal barrier. Whatever so far we have discussed, just go through. With this, just will wind up our class. If you have any doubt, you can contact me. Okay, bye. Take care.